In our next segment, produced by Senior Chevin Harrelson, we head over to the St. Mary's Sleep Disorder Center to talk to Dr. John Rodriguez about the many sleep disorders that are overlooked and how they examine patients in their tests.
Thank you, Dr. Rodriguez, for meeting with us today and telling us more about sleep disorders and what you do here at St. Mary's Sleep Disorder Center.
Most welcome. Thank you.
Dr. Rodriguez, what is a sleeping disorder?
A sleeping disorder is any disorder that affects a person during their sleep and then has consequences on them while they're awake.
And how prevalent are the sleeping disorders?
There are about 80 or more listed sleep disorders. The most common sleep disorder that we study here is obstructive sleep apnea. The incidence of obstructive sleep apnea is, depending on the study, in males between 4 and 24% of the male population has sleep apnea, and between 2 and 9% of the female population. The most prevalent sleep disorder in this country is inadequate sleep.
Besides what you have already told us, what are some of the most commonly found sleep disorders that you have found in your patients?
The other sleep disorders, there is a condition called narcolepsy. That's another disease that we study here at the sleep center. It's a disease of excessive sleepiness. And what's interesting about this disorder is that it's a disease of young people. It usually starts in the teenage years or in the 20s, in the second or third decade of life. And it just causes patients to be excessively sleepy to the point that they actually have sleep attacks and can, fall asleep while driving and so on. So that's another one we study. Then there's restless leg syndrome, which is a condition that keeps people awake just when they're trying to fall asleep. Periodic limb movements of sleep, where the people's legs keep jerking during the night and keep them awake and keep waking them up during the night so they wake up feeling unrefreshed.
Of all the sleep disorders that you have found in patients, which ones have been the hardest to diagnose? Narcolepsy
is a disease that often goes unrecognized because when young people talk about being sleepy during the day, most often they're told that they're not getting enough of sleep or they're staying up too late and things like that. To make a diagnosis of narcolepsy, we have to bring patients into the sleep center, do a sleep study at night, and then the following day keep them here to take naps one after the other. So they come in around 7:30 at night and leave only at about 4:30, 5 o'clock the next evening. So that is a long stretch for a young person to stay at the sleep center, and that's what makes it a difficult diagnosis to achieve, to convince someone to go through a test like that.
You've told us about sleeping disorders that you have found in adults and teenagers, and what about sleeping disorders you found in children?
The children who are referred to the sleep center, the majority of children are referred here to be ruled out for obstructive sleep apnea. The difference between adults and children as far as sleep apnea, when children are diagnosed with obstructive sleep apnea, it's usually because of enlarged tonsils and adenoids, and that is an indication to have their tonsils removed if we notice that they're stopping breathing. Disease, obstructive sleep apnea, is a condition that has now been linked to so many other medical disorders that if one has obstructive sleep apnea, it is important that this disease get diagnosed and treated. The symptoms of obstructive sleep apnea are snoring, stopping breathing at night, waking up many times during the night, waking up to use the bathroom often at night, waking up feeling tired, waking up with a headache at times, and excessive daytime sleepiness. The reason that we need to make people aware of this condition is that we know that sleep apnea is linked to hypertension, to irregularities of the heart rhythm. It can sometimes precipitate a stroke at night. It can also precipitate a heart attack. So if someone has sleep apnea, and very often patients will come in and say that my wife has told me that I stopped breathing in my sleep. And when you ask them when they first mentioned it, they say 5 years ago. It's taken them that long to come into the sleep center, and in those 5 years, they were unnecessarily waking up feeling tired and going through their day feeling sleepy.
How is the sleep study accomplished?
I'd like you to talk to Mr. Don Ladwig, who is the coordinator of the sleep center, who will go into more detail about the sleep study.
After speaking with Dr. Rodriguez, he directed me to the St. Mary's Sleep Disorder Coordinator, Don Ladwig, to learn about how sleep disorders are diagnosed and treated. Thank you, Mr. Ladwig, for meeting with us today. And could you explain to me what it is that you do here at the St. Mary's Sleep Disorder Center and what happens when a patient arrives for their testing?
Well, I'm the coordinator of the St. Mary's Sleep Disorder Center, so I'm in charge of the day-to-day operations of the center and handling the technicians and patients and making sure we have all the supplies we need to do the studies and all the day-to-day operations. And as far as when the patients come to a sleep study, they usually arrive around 7:30, 8 o'clock, and there's obviously some paperwork to fill out first. And after we get through that, then they begin the procedure of being hooked up to the equipment.
When a sleep study is being conducted, like the one behind us, what kind of things do you look for?
Well, we look for heart arrhythmias, we look for breathing disruptions. Also, we look at the EEG waves, the brain waves, to determine whether the patient's awake or asleep. And we can tell if a patient is waking up due to the breathing problems that they may be having. We also look at leg movements to determine if the patient might be, jerking or kicking during the night, and that could be the problem with their sleep disorder.
On the sleep study behind us, what exactly are we looking at?
Okay. Well, up at the top, we're looking at eye movements during sleep. And during REM sleep, the eyes move in a certain pattern, and it's the only time of the night that they do that. We're also looking at muscle tension on the chin here, and also brain waves, so we can tell whether somebody's in, say, stage 1 sleep or stage 2 sleep, or if they're in a deeper stage of sleep. We're looking at the heart rate. We're looking at breathing respirations, so when they breathe in, it goes up, when they breathe out, it goes down, and also on their chest. And we're looking at their oxygen levels as well.
I see the picture at the bottom of the screen. Who is that?
That's actually me. That's my sleep study.
Why would you have a sleep study done?
Well, I was very tired during the day, and my wife was kind of getting on me for snoring, and I thought it'd be a good idea to have a sleep study done and get checked out.
And what did you find?
Well, it appears that I do have some mild sleep apnea. I do snore in my sleep, and I was having a little bit of trouble breathing.
Right. And what did you do to correct your sleep apnea?
Well, I'm being treated with CPAP therapy now, where I'm wearing the CPAP mask, and that's helped quite a bit with being tired during the day. And I've also lost some weight as well, which I think has helped.
Is loss of weight common on people who have a CPAP machine?
Yes, it can be common that they will lose weight with it.
That's a lot of data to analyze. How long after the sleep study can the diagnosis be given?
Well, usually the study is what is called scored, where a technician reviews the study to determine where a person might have had trouble breathing or leg movements or what have you. And usually a diagnosis can be given within a week or two.
What advice could you give to our viewers that are having trouble sleeping but their disorder hasn't yet become chronic?
There is something called sleep hygiene, which has nothing to do with cleanliness. It refers to sleep habits. So the good sleep habits are to try and maintain a regular bedtime and awakening time. After 12 noon, you avoid all forms of caffeine. The other things that are recommended is to have a bedtime ritual, where you actually give yourself 15 to 20 minutes doing the same thing every night to allow your mind to transition from wake to sleep.